Hey listeners, this is Kelsey and Nate here from the Emergency Medical Minute, and we are excited to tell you about our next big event, Untamed, an event about medicine and wilderness as medicine.
Picture this. You are canyoneering in the San Rafael Desert, the most remote desert in the United States, and suffer an unfortunate fall that leaves your right hand pinned by a boulder. Posed by the threat of death by dehydration, you have to choose between your life or your limb. Our keynote speaker, Aaron Ralston, portrayed by the film 127 Hours, was in this exact position. Guests will hear Aaron's story, along with other inspiring tales of survival.
Guests will also hear from a panel of medical experts on how to survive the wilderness and embrace it as a form of medicine. Tickets and event information are available on our Facebook page and website, emergencymedicalminute.com.
All right, so good evening, everybody. So this is a medical minute that actually made some, it's a subject that was in the national news a couple of days ago because of a couple of big studies. So people might have seen some news about this, but in the New England Journal, kind of one of the biggest journals of medicine, there were 3 studies published last week about long-term aspirin use in the elderly, and it was kind of fairly interesting. They basically took healthy elderly patients, so people who didn't have risk factors or didn't have previous heart disease or strokes, and put them on long-term baby aspirin to see if they had effects. And they were pretty kind of ambitious studies. They wanted to see if you could decrease mortality, if you could decrease disability, or if you could decrease kind of development of heart disease, strokes in elderly patients. And all 3 of the studies that were done separately were negative. There was no benefit to taking aspirin long-term if you didn't have either risk factors or a previous stroke or heart attack. And then actually they found increased bleeding risks if you took aspirin long-term. And then the mortality study actually showed higher mortality from taking aspirin in patients who didn't have a clear indication for it. So, anybody here who's elderly and was thinking about taking aspirin just for fun, probably not necessary. And if patients ask us, well, maybe I should just take an aspirin just because now there's some studies that show unless there's a good indication for it, probably no benefit. Any questions? Thanks, guys.